Hi, I am Dr. Ayda Basgul. In this video, I will talk about structure and movement of the knee joint and give a few examples of related clinical terminology for beginners. I would like you to hear your feedback. You may either click the like button or leave a comment below. And make sure to subscribe my channel anytime you wish. Knee joint is structurally synovial type modified hinge joint. That means it is type of joint that has joint capsule and synovial membrane in it. And acts not only as door hinges to allow opening and closing between thigh and leg, but also medial and lateral rotation of the leg in a limited degree. Functionally, for that reason, it is a diarthritic or freely movable joint. Knee joint allows flexion and extension of the leg. Just to remember, flexion is the act of bending or decreasing the angle between two body parts, and extension increasing the angle between two body parts, which is thigh and leg for knee joint. Also, when knee is in 90-degree flexion, as shown in this picture, it allows in a limited degree medial and lateral rotation of the leg. Knee joint allows your leg to kick and jump, run and leap and climb. Knee joint, as all synovial joints, has a joint capsule formed from the connective tissue. The capsule has inner membranous layer and outer ligamentous connective tissue layer. The inner layer formed by synovial membrane, a membrane that consists purely connective tissue. Release synovial fluid or synovia into the synovial cavity of the joint. Synovia has egg white-like consistency. The principal role of synovial fluid is to reduce friction between the articular cartilage during movement and lubricate the joint itself. Just to give you an idea, in a healthy adult knee joint, the normal synovial volume is 6 milliliter. It can be 2 milliliter less or more at any given time. Knee joint is the largest joint in your body, and it is also most complicated. Knee joint has 3 bones: femur of thigh, tibia of leg, and a sesamoid bone, patella, in the front, anteriorly. Many ligaments, cartilage pads called menisci, and synovial field membranous sacs called bursae. The knee joint is where is the medial and lateral condyles of femur bone of your thigh and medial and lateral condyle of tibia of your shin meets that allow flexion and extension. There is another bone called patella or kneecap. It's part of the knee joint. Patella means small plate in Latin. It is a sesamoid bone. When we born, patella made up a soft cartilage that hasn't yet ossified into bones. So kneecaps won't be seen on X-rays until somewhere between 2 and 6 years of age when they ossified. You can walk without a kneecap. However, kneeling will be a challenge. You may require protective gear without a kneecap to kneel down. We can walk on 2 legs so easily because our knees can fully extend and lock. For example, chimpanzees cannot do this on 2 legs. So when they try to walk upright, they have to use a huge amount of muscle power to support their body weight. And they end up rocking back and forth in the process before resorting to 4 legs again. The ligaments of the knee stabilize the knee joint. Let's discuss them on the illustration. The 4 ligaments in the knee joint connect the femur to tibia. 2 of them found inside the joint capsule. We will call them cruciate ligament because they pass each other in a formation that resembles the X letter. And 2 of them located on the sides. We will call them collateral ligament. They are forming the outside layer of knee joint. Your lateral collateral ligament, or LCL, and medial collateral ligament, MCL, the two collateral ligaments in your knee, work to control the sideways movement of your knee joint. Two cruciate ligaments in your knee, your anterior collateral ligament, or ACL, and posterior collateral ligament, PCL, are unique because they are located inside of the joint capsule and work to control the backwards and forward movement of your knee joint. And another ligament we call patellar ligament here, continued from quadriceps muscle tendon and connects the patella to the tibial tuberosity. Anterior cruciate ligament, notice, connect the anterior portion of the tibia, that's the name come from, ACL or anterior cruciate ligament, connects the anterior tibia to the posterior lateral condyle of the femur. Posterior cruciate ligament connects the posterior tibia to the anteromedial portion of the femur condyle. Tibial collateral ligament, or MCL, connects the medial condyle of the femur to medial condyle of the tibia. And fibular collateral ligament is another name for FCL, located between lateral condyle of the femur and the head of the fibula. Bursae. Fluid-filled sac-like cavities are known as bursae. These are located where muscles and tendons move over bony joint areas. Their function is to reduce friction caused by muscles and tendons moving against the skin and bones, as well as to facilitate the movement. You can see suprapatellar, prepatellar, and infrapatellar bursa, which they are above, before, and below the patella in this illustration. The inflammation of bursa called bursitis. Clinical applications. Arthritis is the name for inflammation of the knee. It may cause due to overuse, bacterial infection, and autoimmune diseases. I wanted to give you an example of the Lyme disease, a bacterial disease, and can be treated with penicillin antibiotic, usually affect the knee joint as well as causing fascial paralysis and bull's-eye rash in 80% of the people. Arthroscopy is a surgical procedure to examine the joints. I hope you enjoyed and learned the subject we discussed. Feel free to click subscribe button to be aware of the newest videos.